Hello, everyone. I'm Dr. Steve Johnson. Thank you so much for tuning in. I'm here with Dr. Sean Lavity.
How's it going?
And we're super excited to be with you today. Our goal is to come to you this year in 2020 each week with the idea of sharing different tips, techniques, and trends that are going on in the world of dentistry. It's interesting, Sean. I know after he does a treatment plan or after I do a treatment, we'll have these little sidebars in our office here, and we'll talk about the successes of these treatments that we just did on a patient, or perhaps maybe something that a patient's doing at home that they're having great success with that we want to share with other patients. And we were talking about this thinking, why are we just having this conversation, us two, or with the hygienist or with Dr. Brioni, and why don't we share this with our patients?
Why not get this out to the patients?
Absolutely.
And give everybody this information.
Absolutely. So that's the goal. Our goal is to come to you each week and to share something with you that's going on in the world of dentistry. And one of the hottest topics that has been for a couple of years, but the technology is getting better and better, is that in the world of dental implants. Mm-hmm. And so I've asked Dr. Lavity, we've been working together now 12 years?
10 years.
10 years. Okay, 10 years. It's been phenomenal. He is literally the foremost expert in dental implants. He understands it. He has literally placed thousands of them. I'm not sure how many, but this is what he does. And so tell us a little bit about yourself, Dr. Lavity. You went to what...
I did dental school and my training at NYU in New York City, and then I worked afterwards there for a year or so before moving here to Santa Barbara.
Perfect. And did literally hundreds of hours with some specialists there in New York. Was it New York you were doing the training there with?
Yeah, I did my initial training there at New York through both NYU Hospital and Bellevue Hospital through their oral surgery departments.
Awesome.
And then since then, I've done hundreds of hours of continuing ed in this field.
Yeah, no, and it's just an incredible. It literally, I personally believe that dental implants is the standard of care. If you have the bone, if you have all the the space there, and you have the bone and the right things, I mean, an implant is a ton better than doing a bridge. We can talk about that in a second. And
yeah, it's really the best way that we can replace a lost tooth nowadays.
Perfect. So what I thought I would do is, and I'm going to put Dr. Lavity on the spot here, is I thought I'd be the patient, and I'm going to go ahead and talk to him about some of the key questions that I get. I'm sure you get the same questions, and they're very basic questions. And I just want to see how he would respond to them, and hopefully it'll be beneficial to you guys. So the first question I get, this is really simple. I mean, but it's like, what is a dental implant? And the follow-up question is, how will it affect my oral health if I don't do something, or if I leave the space in there? Tell us about a dental implant and the benefits.
So essentially, a dental implant is a prosthetic replacement for a natural tooth. It's the whole thing is composed of the implant itself, which is essentially a small titanium screw that is placed down into the jawbone. Right. Titanium has the unique properties that our body doesn't recognize it as foreign, and so there's no rejection of it. Once that is allowed to heal into our bone, then we can build up a ceramic tooth similar to the crowns that we put on natural teeth. Once it's all in and put together, it's just a combination of titanium ceramic. You'll never get a cavity on it. I like to refer to them as kind of like a bionic tooth.
Yeah, no, and they are truly amazing. What happens, for instance, you see a patient and they either need to lose their molar tooth or they're already missing a tooth. If they don't replace a tooth, like if a patient asks you, if I don't replace this tooth, doc, what's going to happen?
Okay, I mean, there's a variety of things. First off, you're going to have less chewing efficiency just in terms of function. Things that happen to the mouth itself, you're going to start seeing teeth shifting. Teeth all tend to hold each other in place. Also, when teeth are not there to exert certain pressures and stresses on the surrounding bone that holds them in place, the body doesn't have those triggers to maintain that bone, and that bone will slowly resorb over time.
Yeah, so teeth will continue to shift. So, and he's 100% right, is if you're missing teeth, or even if you have all your teeth, and when you get in my age, in your 50s, you're going to notice these lower ones are shifting more. Teeth are going to continue to move. And if you have a space there, it will really move quickly, and then it throws your bite off.
Correct.
I also seen patients who have chronic headaches because they're missing teeth. Mm-hmm. They're biting, they're not chewing properly because things are not working harmoniously. Is that correct?
Correct. Yeah. As the bite shifts, you start getting these spaces from the missing teeth, and teeth start to kind of tilt into those spaces, and that, as those teeth tilt, it throws the bite out of whack, which can then lead to issues with the temporomandibular joint, or
Yep.
TMJ. The TMJ issues, it's very common for those to lead to issues like migraines, headaches, other
Absolutely.
sorts of myofascial pain, and a lot of other things that come along with that.
Perfect. Okay, so let's just walk through the process real quick. Say I have to have a tooth out and I want to have an implant done. What's the timeline?
Timeline is typically it's about a 6-month process in
Okay.
total. There are certain cases where we can do it faster, and there are some cases where it takes longer. But that, I would say, would be the average.
So, like for instance, if I need to have my tooth removed, we let that heal, and we let that heal for 2 or 3 months. Okay, is that correct?
Correct. Yeah. First, once the tooth comes out, we extract the tooth, and ideally, we like to
Do
repair
grafting.
that hole that's left by the tooth with some bone grafting.
Okay.
That allows us to rebuild the bone back to the level or to maintain that level that it was around the tooth.
Gotcha.
If we just extract a tooth and let it heal on its own accord, we tend to see a lot of shrinkage of the bone in that
Yep.
area.
And so what he's saying there's the bone will actually it'll recede. It'll be like a U shape there.
Yeah, you'll end up with kind of a divot from
Yep.
left where the tooth was.
Perfect. And then once that heals, then you place the implant in there, which is the
Correct.
titanium
That's the
screw.
little titanium screw, and once that goes into the bone, it needs a few months for what we call integration. Essentially, it's the body growing new bone cells and attaching to the surface of that,
Perfect.
so it's nice and strong.
So when it becomes nice and strong, how long will it last, do you think?
Once the implant is fully integrated, if it is properly cared for, it should last you the rest of your life.
Which is amazing, absolutely amazing. Because if we do a bridge where we use the 2 adjacent teeth, the average bridge will last maybe 7 to 10 years, according to the American Dental Association. An implant, where you don't have to touch the adjacent teeth, if it's done properly and you have adequate bone, just like Dr. Lavity was explaining, will last you the rest of your life. Now, I have personal experience with this. I don't have an implant. I'm not sure if you do or not.
I do not.
But my wife has a dental implant, and she had hers done when she was 19 back in 1989. And so we're reaching 20, so it's 31 years old now. And she was probably one of the first patients in Utah to get this implant. It was kind of this newer thing. The doctor was progressive. And the cool thing with technology today is when you talk about grafting, when they did her graft back in 1989, they took it from her hip. And so it had to be in a hospital setting. Now we use the synthetic bone, these bone crystals. It's a real simple process, it's pain-free, and it actually is as hard as a rock once it heals. But what I was going to say is, an implant, if you can do it, is the best way to go.
Absolutely.
So that's awesome. So we also get questions about obviously the cost of an implant. You know, because people are like, oh my gosh, but it's so expensive. They're really not that expensive. If you think of the cost of a bridge, you got to have that replaced 2 or 3 times throughout your life.
Correct.
Okay, that could be like 3 times more expensive than an implant.
Yeah, if you look at the whole life cost of replacing that tooth, an implant's definitely going to be less expensive, unless you're
Yeah.
really unless you're really old and kind of on the towards the end of your life.
So very true, very true. But I mean, so anyways, I want to thank Dr. Lavity. He literally does this every single day. He puts these implants in. He takes care of them. I also help take care of them, but he is the expert. I have him place all of them. I don't place them. But we also just want to also let you know this month, in a couple of weeks, we're having a dental implant seminar. We do this about once or twice a year. And it's going to be January 30th, is that correct? January 30th at 6 p.m. right here at the Santa Barbara office, where we'll have probably anywhere from 20 to 40 people here. And we go into much more depth about the implant process. We have a little presentation that's about 20 to 30 minutes. And then we'll do a free new patient exam to see if you're a candidate for an implant. We'll go over everything with you. And it's a great thing. Don't you think it's a wonderful tool, wonderful thing for patients?
Yeah, we've been doing them now for
5-6 years?
5 or 6 years, and we get really good response because everybody gets to come in and kind of learn a little more in detail about the whole process. And then when we're finished, we can put together a plan custom tailored to whatever it is that you need.
Exactly. And then, of course, if you have any questions, we'll answer questions for you that night. And then we'll take a CT. We have this amazing CT. It's a 3D image of your mouth. We take that. We don't charge for that either. And the last thing is, I know we'll have some type of special price. We always have additional special pricing at that implant seminar. So if you do or you're available, you want to come check us out, it's January 30th. It's a Thursday evening at 6 p.m. And gosh, thank you so much, Dr. Labadie.
RSVP.
Oh, an RSVP, that's the best thing to know. So we know because we have food and things like that, but sometimes we get a little crowded and we got to cut it off because we only have so much room in our waiting room. But please RSVP, let us know. Give us our office a call at 805-687-6767. If you have any additional questions or you want to just come and talk to Dr. Labadie or any one of our doctors in any one of the offices, you can go to our website at johnsonfamilydental.com. Also, what I would like to open up to is if you have questions, not just about implants, but about dentistry in itself, maybe what's going on in your mouth, by all means, fire out a question on Facebook or I'll have Alex put a link down below of an email that you can email us questions, and we'll keep this open. We'll answer your questions next week if you have any specific questions for us. So thank you so much. You guys are awesome. And as always, a smile can change your life. And in this case, a dental implant will definitely change your life because it has for my wife.
Definitely change your life.
And wish you guys all the best. And until next time, thank you.
Thank you.